Hello, and welcome to Mental Health Matters podcast. I'm your host, Liz Lang, and I'm here with Dr. Mark Burton. In this podcast, we will talk about all things mental health. Thank you so much for joining us. Hey guys, Liz Lang here with Dr. Mark Burton, and this week we are going to get into differences in depression. And so we're going to start off with a disclaimer because we're going to make a lot of generalizations about men and women. So the thing is with generalizations is it's usually because there's a pattern that you see, but they don't always hold true for everybody. So when we say this is how men typically present in depressed situations, and this is how depression typically presents in women, it's a generalization and it can crisscross across genders very easily.
Mm-hmm. No, I agree. I'm glad that you often give those disclaimers about our generalizations. So I agree with you. It's a pattern.
Mm-hmm.
Doesn't mean that it's always going to be this way. So we acknowledge that.
Yes. So depression does typically tend to manifest differently in men and women. And the treatment can be different, but I think it can also be the same in a lot of ways. And so there's a lot of similarities. I think the biggest similarity is in terms of treatment is compassion. That's probably one of the key components in treating depression is compassion.
Right, and understanding, but I think I don't know that we'll go much into treatment tonight, but medically speaking, if you're seeing a psychiatrist, and I think the treatment, the pharmacological treatment is probably the same. I haven't heard of any differences. But as I was thinking about the differences, I think that it's mostly about culture in my mind.
Okay.
The cultural differences in how we raise men and women, I think, are manifest in the ways that depression is expressed for each of them. And so if you think about how women are more culturalized to, think about emotions, and it's more about their relationships to other people, I think, than anything. And whereas men, it's more, I think, about how, let's say, effective they are in the world and how in control and how good they are at solving problems and things like that. And so I think often for depression, say for women, if they feel disconnected from others, then that often leads to them feeling depressed. Whereas men, if they feel like their life is somehow out of their control or they aren't effective, then they can feel that depression as well. So I think that the differences in the way we get there, men and women get to depression, can be different as well. And I think it's mostly about culture.
Yeah, I think especially in terms of stigma, it is much more socially acceptable for women to feel depressed than men, or it's more acceptable for women to express it.
Right, and to seek help as well. So statistically, you're talking like women experience depression 1.5 to 3 times more often than men. Now, there's some thought about this, though, that with men, it's just as high. They just they don't realize it.
Yeah.
Often they don't realize they're depressed, and then if they do, they are much less likely to go seek help. So statistically, they aren't going to appear in any of the statistics.
Right.
And so I think it's really hard to say, that women experience depression more often than men. It very well could be equal. It's just the way women are more open to it. You're right. They're more open to say, yes, I'm depressed, and then I'm going to go get some help with it, whereas men are much more reluctant. I think that also this is where the cultural piece comes in to play, that men seeking help think of it as being too vulnerable or weak.
Yeah.
I hear that all the time. I mean, if you think about couples coming in for couples work, it's way more often the wife who's calling or the female in the relationship who's calling to set it up because it's socially acceptable for them to seek counseling. And the men often come reluctantly. And so I think that that's exactly what happens with depression. Although, so if I think about, say, 20 to 25 years ago, I think in my experience, it was much less likely for men to come in seeking help around depression. I think that's starting to change. So
Yes, we are
I,
culturally, mental health in general is being destigmatized, which is a good thing. And one of the positives is that it's more acceptable to not be okay. And it's okay to
yeah.
admit that you're not okay. One thing that's kind of becoming common in workplaces is mental health days. Just giving people, I mean, it just, X amount of days a year to just, you don't need a reason. Just, I need a day to just not go to work and not
Mhm.
be at work. And that's a good thing, but I think there's still a lot of work to do. And I think one of the biggest things is just helping men to learn to label their emotions. And, again, generalization, there are men out there who are great at being emotional and at labeling emotions and understanding and are very in tune with their emotions. And so I don't want people to think that, you know, we have like this negative opinion of men and their emotions, because there are certainly men out there who are great at this. But statistically and culturally, that's just kind of where we're at is, we need to help men better label their emotions and better learn to recognize when they're feeling an emotion.
Yeah, and one of the things I'm doing more often in my couples work, but even actually I'm seeing some individual men, and I'm doing it with individuals as well, is if you increase males' vocabulary, emotional
Hmm.
vocabulary,
Yes.
then in fact, it's essential to increase their vocabulary in order to help them to be more aware of what they're feeling. Because if the only emotion words you have are anger, sadness, happy, frustration, those are kind of the big ones, mad, then that's all you're going to feel. And so I have this whole list of, I don't know, it's got probably 100 different emotion words on it. And often it's just different ways of saying the same thing, but it gets people thinking about it, gets men thinking about it. What I've also found really helpful is for men it's like keeping a log or a
Hmm.
sheet. And so 3 times a day where you check in with yourself, you have that list in front of you. So you aren't just going to anger, happy, sad, mad, but you have this whole list and you pick out one or two. Here's what I'm feeling right now. And then here's the reason I'm feeling it. So I think that in my view, it's a skill, and then we don't teach men how to do it, but they
Yeah.
can easily learn
Yeah.
because I've seen it. And so men, and it doesn't take very long either, because all it is having the language and the vocabulary and then being more aware. That's it.
Yeah, and oftentimes just studying that list and just, or just reading that list is enough to say, I recognize this emotion, or I
Yeah.
recognize that I've felt this emotion, or it's like, oh, okay, yeah, this label is helpful. So, oftentimes it's just having the tools.
Right. Right. So if we think about the differences in depression between men and women, we should probably break it up in what are some emotional differences or emotional symptoms, cognitive symptoms, and behavioral symptoms, and then physical symptoms, because I
Yeah.
think they're probably different on all those different domains. And so for women, and again, when I list these, I think there's a huge cultural component here. If we think about common emotional symptoms, when I think about this list, it just the cultural stuff comes out really strongly. So for women, more guilt,
Hmm.
more feelings of worthlessness, hopelessness, what we call anhedonia. And anhedonia is, I guess, just a fancy word to say that it's an inability to feel joy. Uh, and
Okay.
then mood swings. Whereas for men, it's always about anger,
Yep.
irritability, and restlessness. And so, can you
Okay.
see the differences in how men approach the world? They get angry very easily, right? So if
Hmm.
they aren't feeling well, they don't think about, well, what's going on in my life. I just get angry because I'm not feeling well, and so they get stuck in their anger and their irritability. And I think part of the problem is they don't realize what might be causing the depression, and they probably don't label it as depression,
Hmm.
but they just say, I'm being angry today or I'm being irritable today. But for women, it always goes to, it's really internalized. I think that's the other thing
Hmm.
that really stands out to me. They feel worthless. They feel hopeless. They have these mood swings. They feel guilty.
So here's I'm going to give you a really good example of why these generalizations aren't always true. My
Hmm.
depression manifests way more towards the way it typically does in men.
Like
My
with anger and irritableness.
Oh yeah. Yeah, that's the key thing for me is like when I'm feeling depressed or when my depression is bad, I'm really snappy and I'm irritable and I'm grumpy and I flood is really
Hmm.
what it comes down to is I just, you know, again, it's just it's very individual and depression is different for everybody. And there can be and women can have both, right? So these lists that we're describing for men, women can have them in addition to some of these ones that we're describing for men. And it's the same
Yeah,
thing vice versa. So I mean, it's not like if, you have to fit into just the single category. You
right.
can have symptoms these some of these psychological symptoms of both.
Right. I agree. And it's just often
Yes.
manifests in this way. So those are some of the emotional differences. I think cognitive differences for women, they go more to self-criticism
Hmm.
and a loss of control, which I think is common with everyone. I think I've said that many times that common theme that I see in depression is that people have this sense that either part or all of their life is somehow out of their control.
Hmm.
And we really hate that. And in fact, as far as treatment, you talked about compassion, which is really important, and empathy. But when I'm working with someone who's depressed, often what we'll focus on is, okay, where in your life are you feeling like you don't have control?
Yeah.
And then let's start, outlining steps where you can get some control back. And so they get that forward movement of getting control over part of their life or all of their life. And that's often what pulls them out of
Hmm.
that depressive episode, is seeing that they actually can get control again. But, when you think about life nowadays, for many, many people, they really don't have a lot of control in their life. I mean, the economic situation, even the extremes in, say, weather, that
Yeah.
we're all experiencing. You have like fires,
Hmm.
all over the world. I mean, there are these fires that break out, right? Hawaii
Hmm.
is one thing. I mean, think no control whatsoever. That's really depressing to go through a natural disaster, something like that. So there's a lot going on in the world that it's going to lead people to feel like they don't have control in their life anymore.
Yeah. And so I think this leads to a good topic of chronic depression versus situational depression,
Hmm.
which I think is important to talk about because, I think that or I guess maybe even the difference too between sadness and depression. And so, you can feel extremely sad because this natural disaster has happened. And I think it's very natural to feel a prolonged sadness over this and to grieve and to mourn, but it doesn't necessarily mean that you have depression, right? And now when it can turn into depression is, if it's been a while and you find you're still not coping well, right? So it can, and that can certainly happen. You can certainly go through this natural disaster. Maybe you went through one of these wildfires and then you hear of these wildfires that go on in other places and you think, man, this is just life. And you start to feel
Hmm.
this sense of hopelessness. It can certainly lead into depression.
Yeah. And I've often thought that we have lost the ability to say, I'm sad.
Yes.
And I think the reason we have, I always blame it on the drug companies, because
Hmm.
you can't prescribe an antidepressant for sadness, or you shouldn't, doesn't make any sense. But if
Yeah.
we label everything depression, then that increases their market for those drugs. But I think also situational depression, that makes sense because I mean, just by its very definition, the word we're using makes it seem more short term.
Hmm.
But I think long term chronic depression, then I think what happens is there's a lot more chance that your brain actually goes through a lot of changes,
Right.
and it becomes much harder to pull yourself out of that, I think. And that, from my understanding, that long term chronic depression, that's really what, at least when they developed antidepressants so many years ago, that's really what the target was, is that long term chronic depression. And and in fact, for situational depression, or sadness, it doesn't make much sense to me to go on an antidepressant.
I agree with that. And I'm not trying to mitigate situational depression or situational sadness. I mean, there are certainly situations in which it is very appropriate to grieve or to feel depression. I mean, if a loved one passes away, then, situational depression, I think, is very normal. And I don't want to mitigate anyone's pain or anyone's grief in those situations, but it's important to know the difference, because if you do get into that, so like you do lose a loved one, and you can't get out of that depression, then it's time to seek help.
Right. And so we actually, we did an episode on grief,
Hmm.
quite a while ago, but we think of them really differently. And
Yeah.
so if you have that long-term grief, then that is certainly something that you need to get help on. But I think we'd probably still call it grief rather than depression. And I
Hmm.
think depression is often, it's hard to get out of bed, or
Yeah.
you get out of bed and you don't look forward to the day, or maybe you're missing days at work, or maybe you're isolating from family members and friends. I mean, those are all, things that happen with depression. For instance, if we look at the behavioral differences for women, it's much more like about crying. They cry easier. But then think of the culture. Men don't cry
Hmm.
very often anyway. But again, that's just cultural. For women, decreased appetite, increased suicide attempts for women. But for men, they go to risky behavior and alcohol and drug use.
Hmm.
They try and self medicate, I think, is really common for men as far as how do they try. What are the behavioral symptoms that accompany depression in men? So I think that for women, that emotional expression is much more out there, right? I think it's easier to see depression with women because they're
Hmm.
okay with people seeing it,
Right.
and they realize that they see it in themselves. And for men, I think it's very hard for them to let people see it,
Yeah.
and that's because it's hard for them to see it often themselves.
I think it's hard for men to show weakness
Yeah,
or to appear weak. And I think depression is viewed as a weakness, and it's
yeah,
really not. It's just human,
yeah.
right?
Yeah, and you're right. We have conditioned men to feel like they are not masculine if they show any sign of weakness.
Hmm.
And again, as we said a while ago, I think that's changing. Seeking mental health treatment is a lot more acceptable nowadays than it used
Hmm.
to for men.
Hmm.
And, acknowledging that you're having a difficult time, I think is a lot more acceptable for men than it used to be.
Yeah. So one thing that I do want to mention briefly that is a distinction between men and women, and that's postpartum depression,
Right.
which is situational, but also can warrant medication in that instance. So, and postpartum depression is very much hormonal.
Hmm.
And one of the things that I always like to explain, or that I think should always be talked about, is all women are going to go through some sort of postpartum hormonal shift. So your hormones are all sorts of out of whack. And so it's very normal to feel that, especially in the first 6 weeks postpartum. And, I think that's one thing that is not talked about enough in the experience that is giving birth, is that,
Yeah.
I mean, you're going to feel just like an emotional roller coaster is what you're going to be on. And that's very normal and very okay. But if it's going on longer than 6 weeks, or if it's to the point where you can't get out of bed, or you're having a hard time taking care of your baby, or you're having thoughts of hurting yourselves or others, it's very important to seek help right away.
Yes. And I don't know if it was different. You gave birth most recently a couple of years ago, right?
4 years ago, yeah.
And did you and Curtis go through any classes? Maybe for your first child?
Yes, we certainly, I mean, we went through a number of classes, I think, for in terms of, and I know it was talked about, but it was brought up, or they asked about it at pediatrician visits. So my pediatrician, in my first, I think the first 1 week wellness visit and the 2 week wellness visit, they give you a questionnaire to fill out. I don't remember, you might know what it's called. It's the depression. It's a depression
Oh, there
questionnaire.
are quite a few different depression inventories. But what I'm more curious about is like so it's been over 40 years since we had our first child. Nobody talked about the possibility of depression though after birth.
Yep.
And so I was just wondering, I think it's good that they're checking on it after, but I think it would be a lot more helpful to warn people and to say, you can expect these hormonal changes, and here's what might come of these hormonal changes, because I think people anticipating that something might, throw them into a depression is pretty helpful, because then you can prepare for it.
Right. And so I think they did talk about some of the big things, like if you feel like you're going to hurt your baby,
Yeah,
those kinds of things, or some of the big, loud symptoms of postpartum depression. But I mean, I think what can be, I think there's quieter ones that are still dangerous or still problematic. So, I've heard of women who they can't leave their house, right?
yeah,
Or they feel like they can't leave their house. Or if you are, if you're overly concerned about germs, right? Like I've heard of women who, after they change a dirty diaper, they have to essentially scorch their hands or,
yeah,
overly sanitize. And maybe those aren't as much talked about, but that's part of postpartum depression, and that's problematic. And so if you're experiencing these things, seek help, talk to somebody. And, I remember for me, one of the biggest fears is that they were going to try to take my baby. That was my
um,
biggest fear.
I was sure.
Yeah, because I had thoughts of hurting her. And,
Uh-huh.
and that's an awful, awful place to be. I mean, I can tell you now, you're going to feel terrible because, and I still very vividly remember being woke up and so tired and so angry. And before I was even fully conscious, I was going from 0 to 60 angry at my baby because she was waking me up
Hmm.
again. And again, you get into the cycle of guilt and shame. And so, which is one of the reasons why I'm so open about it, because you are not a bad person. You are not a bad mother because you are feeling these things and having these thoughts. There is a hormonal imbalance going on in your brain and
Yeah,
inside your body, and you just need some help. And it can get better.
yeah, yeah. And so I just hope that, say, if you're doing any type of pre-birth class,
Yeah.
that they would talk about it. And I think it would be important to label it
Hmm.
as this is depression or possibility of depression,
Yeah.
give words to it, because otherwise I think, those hormonal changes are so out of your control
Hmm.
that, you can feel, I don't like to use the word going crazy, but you can feel like I'm going crazy
Yeah.
because you just had this wonderful experience, you've got this new baby, and I feel this way out of control.
And you're
And that,
tired.
yeah, and you're tired, and that's certainly hormonal. I wish that that would be the next big frontier in medicine,
Yeah.
is to really figure out hormones, because we really don't know a lot about them. I think there are people out there now who say they do,
Hmm.
but I'm really skeptical of it. I think there's a lot more work that needs to be done. But it's an incredibly complex physical system. And
It
I
really
think
is.
that's why
Yeah.
it's so hard to pull apart. But boy, wouldn't that be great if we could somehow get more control over our hormonal imbalances? Because it happens for men as well.
It
Um,
does. Yeah.
yeah,
It certainly does. It's more common in
yeah,
women, but it
and,
it certainly can. And one of the I think the hardest part, or what makes postpartum depression so particularly difficult, is the lack of sleep. And
mhm,
lack of sleep makes everything worse. And
yeah,
so, when you have a new baby, you could just expect people to not be sleeping, right?
yeah,
And so that was something that I think I felt the least prepared for. And, and it's interesting because I knew going into it, I knew that people told me, like, you have to wake up every few hours to feed your baby. I just wasn't emotionally and mentally prepared for how hard it was going to be to do that.
yeah.
And,
And I think it's different for every person as far as
it
that
is.
lack of sleep.
Mhm.
I think lack of sleep is hard for most everyone, but still it affects others, in a pretty profound way. So I think one of the biggest differences, if we're talking about the differences in depression for men and women, is women generally do not have as good a sense of what we call mastery.
Mhm.
Then, and again, that's the feeling in control. It's just another way to say
Okay.
that. feel in control. But again, generally speaking,
Hmm.
they don't feel as if they have the mastery over what's really they can control and influence in their lives. Now, I do think that's changing as women are very much into the workforce.
Hmm.
And in those certain situations, they're really in control and they do have a lot of mastery. So I think it is changing slowly, but that's one of the big differences. And so there's a big correlation between gender, between
Hmm.
male and female mastery and the appearance of depressive symptoms. And so for men, they're thinking that, if it's true there's less depression, is that men generally feel more in control of their lives than women do.
True. And I think a lot of that too is almost a little bit culturally, and this is changing largely, but like you said, with women going into the workplace, but for a long time, that's how it was, is women got married and they stopped working. And so there's a little bit of that cultural trickle down effect of, that women, once they get married, they then become a housewife, and then they have kids, and that's their life. And they're dependent on men. And, so I think there's just a little bit of trickle down effect. But it can also, I think, be hard if you go the route of a stay-at-home mom, and if you're not really secure in your relationship, then, that can be really hard to feel like I'm dependent on my husband to take care of me and to take
Yeah.
care of this child.
Yeah. But I also think that, you have a baby, and this is, again, a big generalization. I realize
Hmm.
that. But for most women, they feel like, at least in that first year, they've lost control of their life. It's
Oh, yeah.
not their life anymore. It's their role. All of a sudden, they become the mother to the child, and keeping the baby alive certainly is the primary task. But
Hmm.
so if you think about what typically happens, again, the father's off probably doing his sports, doing work, his
Hmm.
life doesn't change a lot.
Yeah.
And for a lot of men, and for the women who give birth, their life changes in a profound way.
You lose bodily autonomy when
Yeah.
you when you
Right.
I mean, you
You always
really
have
do.
this appendage that's stuck to you.
Yeah, I mean, it's true. I mean, it's a complete loss of bodily autonomy
Yeah.
because, I mean, and especially if you exclusively breastfeed, then you really don't feel like you have any bodily autonomy because you have this thing literally attached to you around the clock. And
Uh-huh.
so, that can be depressing. And
Mhm.
you definitely lose a sense of independence when you have kids. And
Yeah.
so I can see why it can easily spiral out of control.
I just had this thought. I don't know what made me think of this. I think quite a few episodes ago, we were talking about depression and we talked about the cowboys in Wyoming. Do you remember this?
Maybe.
Or maybe this is just something I read. The suicide rate, it was probably last year when we were talking about
Yeah.
suicide.
Yes.
The suicide rate for, I'll call them cowboys, or a lot of people probably don't identify as cowboys, but cowboys in Wyoming. And it was much higher because that whole idea, I don't know where this came from, but the idea of cowboy up, which
Yes.
I think what that means is just don't pay attention to whatever it is that's bothering you and go on with your life.
Hmm.
And the devastating mental health effects of doing that are pretty profound. And the suicide
Yeah.
rate was higher. I think I remember it was probably from last year when we talked about suicide.
This sounds familiar now that you say it, but
Mhm.
I mean, I agree. And so, people who don't face their problems, who try to just run away from them, eventually it catches up to you every
Yeah.
time. You
But I
can't
think that's
outrun
probably,
depression.
yeah, no, you can't. But I think that probably exemplifies in a very concise way the differences in depression between men and women. I think, even if you're on a cowboy, the idea of cowboy up and, just get on with life, that's the way men grow up.
Yeah.
And so, the likelihood that men are going to mask their emotional pain is much higher.
Mhm.
And as you said, you can't run away from it. You
Yeah.
can't escape it. And so the first step of really getting over it is to acknowledge it. And then if you have to, seek treatment. And everyone who's depressed certainly doesn't need treatment, but you need to
Right.
acknowledge it and then figure out a way to change something in your life. So I think the other thing that I mentioned earlier is for most men go to substances, drinking.
Yeah.
Drinking's a huge solution for depression for men.
But it's not a good one.
A very poor solution,
Yeah.
and which causes all sorts of other problems. But I think that's really the biggest difference is women are more out there, more comfortable being out there with their emotional pain and willing to try and figure it out, and men are not. That's the difference. So there we've just boiled it down to that simple thing. But I think it says a lot about the differences between men and women.
So, let's change the term cowboy up and admit it.
Yeah. I
cowboy up and get help. Like that's,
that's it. Cowboy up and go get help,
Yeah. Cowboy up and admit that, you know what, I'm not okay and I need help. And it's okay to need help. That should be the new slogan is cowboy up and get help.
Yes. Okay. Get some t-shirts made.
Yes. Yes. So one thing I want to mention just briefly before we wrap up, and that's compassion fatigue. So there's this whole other side of depression that isn't talked about as much. And that is those who are caring for someone with chronic depression.
Oh, yeah.
And
tough.
Yes, and just how draining it can be. And so one of the ways that it can be so draining is, like let's say your spouse has chronic depression and your spouse gets all of this attention, all of this accolade and all this support and all this love because they're the ones that are dealing with it. And, they do deserve those kudos, right? Because they deal with it. But you are the support vehicle. And you know what? You deserve a lot of recognition and a lot of compassion too, because, it can be hard to manage it. Life keeps going on. Even if your spouse feels depressed, oftentimes I feel like your emotions get pushed to the side in lieu of this person who has chronic depression. And so,
and then often too, if you're a couple and you have children,
yes,
and one of you's depressed and the other one then picks up the slack and becomes almost like a single parent.
Yes.
Which is very hard, which is that fatigue, that compassion fatigue.
Yeah. And so, I just want to acknowledge and validate that it's a real thing. And, I see you and I see your fight.
Yeah.
And, you deserve to be seen and heard as just as much as your spouse who is depressed.
Yeah. And I'll remind people of the book called Lost Connections by Johann, which I think is a really great book that talks about the increase in depression and anxiety. And, we've talked about so many times on our episodes the importance of having connections with people. And I think that's especially true with depression. I saw a gentleman, in my office today who's getting a divorce. He doesn't want a divorce, but what we're doing is we're making sure that he doesn't isolate because, the isolation just makes the depression worse.
Yes, it definitely does. And it can be hard to convince somebody who is depressed to get out and go move. But, I think just gentle encouragement is key here.
Yep.
All right. So next week is going to be a bit of a continuation. So September is Suicide Awareness Month. So we are going to be getting into talking about suicide for the whole month of September, which is a very important topic. And so one of the things that we're going to get into is the differences in men and women in the way they attempt suicide. And we'll also talk about why men often complete suicide more than women. So I will also, as always, when we talk about suicide, mention the new suicide hotline, 988, if anybody needs that. And in the meantime, we will see you all next week.
Have a good week, everyone.
Have a question for Dr. Burton? How about a topic you'd like us to cover? Send us an email at mentalhealthpod21@gmail.com. This podcast was produced and edited by Liz Lang. Music is by Audio Lounge.